Well, my name's Rick Simcock, and I have been an endodontist for 24 years. I've worked with coaches and mentors from the very beginning of my practice, and one of the most meaningful parts of learning and trying new things and opening one's mind has been that ability for coaches to kind of open my mind to what's possible. And I just really wanted to bring my experience to other endodontists to maybe share and maybe help people love their practice a little bit more, get more efficient, develop some systems so they're back in the driver's seat with their practices. And all of these systems and all of these ideas and creative aspects of creating a schedule are adaptable to absolutely any practice. And I think that's the important thing for people to understand. When a patient first calls our office, there's a whole process that we go through of really wanting to know the symptoms, who their dentist is. I train my front desk team to really be able to get a sense and a feel of whether this is a treatment or whether this is something that we need to just do a consult on. And we've realized that process from the very first phone call, going through all the information, checking insurances, talking fees, answering questions, all that whole process is about a 15 to 18 minute conversation before that patient even comes through the door. We really want to talk to that patient at some point before their appointment. You know, that you get the vibe, you're able to really talk to them and get to know them. Maybe there's some things that you pick up on the phone that a text saying, hey, don't forget your appointment tomorrow at 10. You kind of miss out and you don't really get a chance to make a relationship. And so I really want my team to form relationships with patients. And because once that happens and they have a good root canal experience in your practice, they're not going to go anywhere else. You know, many practices that I've worked with, they save that for when the patient first gets to the practice. All that can be taken care of on the phone. So my dental assistant team and actually my front desk team arrive just before 8 o'clock, which is about 15 minutes, 10 minutes before the first patient arrives into the practice. And they are ready to go. They just double check the operatories, make sure that nothing got moved. You know, we talk about a pilot's checklist, and pilots that have flown 20,000 hours, still every flight, they go through that step-by-step checklist. And that's another very important aspect of what my team does. If we start a treatment and this handpiece isn't ready, that burr isn't ready, that file's not there, the gentle wave system is not ready, that just bogs everything down, and we want to make this kind of feel like a Broadway musical or a very well choreographed dance. So I like to start at 8:30 in the morning. That's when I want to see that first patient. My schedule will allow me to see a patient every half hour. And so sometimes people think that by doing a lot of cases that the level of chaos and the level of stress, goes right through the roof. And that's not what this is about. This is about just having systematic steps, procedures that everybody knows where they're going to be at any given time. And so really when people come and observe in my practice, they're really amazed that it's quiet. I'm not rushing around, I'm not sweating, I'm not stressed out, yelling at people. It's very calm. And people are very surprised at that we can do that many cases and still be very relaxed. And so if you look at my schedule, what we have are the doctor and patient time. And so when the patient's supposed to be in the chair at 8:30, that patient will be arriving at 8:10, 8:15, and that's their appointment time. So there's no, your appointment's at 8:30, we need you here 15 minutes early, because that leads the patient to think that they can come anytime between 8:15 and 8:30. So that's a very key component that our front team makes sure happens, is that the patient knows exactly what time they need to be walking through that door, right? So we know that my dental assistants, by the time they grab the patient, build rapport, meet them, verify the symptoms and signs of what they've been experiencing, they will then take the CBCT and then the PA, start the patient on laughing gas, answer any questions that they might have popped up after that initial phone call. And in our practice, that takes about 15 minutes for our assistants to do that.
So while I'm doing the workup with the patient, getting their 2D x-ray, another assistant is in the lab looking at the 3D scan and getting the lengths of the roots for me. Another assistant may be tearing down the previous room and setting that up in preparation for the next patient. We try to be as efficient as possible.
So when I change into my scrubs, and the magic sign is when I slide my door open, that assistant that has the first treatment is ready. She knows everything about that patient, any questions that I need to address with that patient. If the patient's fearful or anxious, I need to know that as well. So they try and prep me as we're walking to the 3D imaging so I can take a quick peek before I go in and see the patient. And it's just about a minute or a minute and a half. And then when I walk into that room at 8:30, I know everything about that patient. And then it's just my turn to introduce myself, make them feel comfortable. So my diagnosis time is about 2 minutes. And then I leave and my hygienist is ready to come right in to provide, painless anesthesia. And she's developed techniques that just are incredible, helping the patient relax. Patients are always so appreciative. It's like we have a numbing specialist in the practice.
My name's Kat. I'm here at North Sound Root Canal. I'm a dental hygienist. A dental hygienist in an endo office is helping to get the patient comfortable, and that includes numbing them or anesthetizing them. Part of that also is seeing their comfort level, how much anxiety they're feeling. If we need to use nitrous to help as well, that's something we can do. Besides just getting them numb, I'm also helping with the flow of the practice during the day. A lot of what I was doing during this treatment is I stand right outside of the room and I'm watching to see when the doctor leaves, then I come right in at that time. So that way it's a very smooth transition. And then also when the dental assistant is getting everything ready in the room and they're putting on that rubber dam, part of what I'm doing is I'm still watching outside of the room and I'm making eye contact with that dental assistant. And when they give me that eye contact, then I go get Dr. Simcock and let him know that the patient is ready. So that way it's also giving him time to do other things that he needs to do, because I'm kind of managing that time flow of the appointment to make sure we're on schedule.
Many times endodontists are like, well, I don't want the added expense of, somebody that's just providing anesthesia. But let me tell you, in my practice, that's been probably the biggest efficiency tip, is that look at that in your practice, because just on average, in a typical day in my practice, she has saved me about an hour and 15 minutes of my time. She allows me to get another 2 cases done a day. And when you look in the big picture of overhead, and it's so worth it. Even if we were doing the same amount of cases, just having that one thing lifted off of my shoulders was really a big development for that. So when the rubber dam's on, I'm back in the room. After I find the canals, get to that level where we're ready to make the platform and the gentle wave technique, and then start the procedure, I do the seal test, which is that first minute to make sure that everything is going to be going great. And then I hand that off to my dental assistant to do the 8-minute procedure with the patient. One of the techniques that I have added to my practice is the gentle wave. And I've adapted the gentle wave because it's taken my efficiency to a whole new level, which I'll get into. So when Kat comes into the operatory to provide anesthesia, I have 2 options at that point. One, that's a transition time for me to go see the next patient, or I can fit in a consult at that point. So in my schedule, most of the time, that second patient treatment is ready. And so I will go right into that situation where the assistant will then share with me all the details about that patient. And again, I go in, do my 2-minute diagnosis, verification, any questions. By then, Kat would be ready to go in and provide anesthesia to patient number 2. Well, because the assistant in operatory 1 is still operating the gentle wave, and by that point, there's probably 5 to 6 minutes left in the cycle, I have time to even see a third patient, a well check, a consult, and still not be rushed, not be hurried, and just be right in the flow of the day. And that's the most complex that it gets in my practice. By the time I get back to operatory 1, the gentle wave procedure is completed. Right now, that's about 20 minutes into the procedure. And now I've already got the second patient getting numbed by the hygienist. So now I just dry and fill, and then a check film. And then I will then sear off the canals, and if we place a permanent filling, that's great. Now I know that when I get up from operatory 1, regardless of whether I do a permanent filling for the patient or whether the assistant does a temporary, I know that operatory 2 is ready for me. And so I go walking in there, the rubber dam's on, and we're ready to go. And that's that key, that we find that flow and your timing for what you're doing. And then we build the schedule around that. I don't like staying past 5 o'clock, and I don't want my team to stay past 5 o'clock. Once you start on this path, you'll notice that most of the time when people are there at the office past 5 o'clock, it's due to some system or some roadblock or some stumbling block in the way, and we need to clear that up. So I like to finish my day with the last patient anytime between 4 and 4:30, and that gives my team a half hour to 45 minutes of getting that office completely washed, cleaned, vacuumed. The front knows that we're going to wrap that day up, so all insurance claims are filed, any voicemail messages that need to be returned, any patients that need to be called, it's all hands on deck. So when we leave the office at 5, the lights go out, the day is completely wrapped up. There's nothing left on that list of things to do. Because we wrap up the day previously and making sure that everything is wrapped up that day, the operatories are cleaned and sterilized and ready for the next day. When we start that next day, we don't have to have people in the practice getting ready for an hour before the new patient. But that is the system of having an efficient office. It's not about having 3 patients at once. That's not the way to keep sane and relaxed. This is about 1 step, 2 steps, 3 steps, and then finding that flow that works for you. We talk about endodontics and coaches. There can be a tendency where people feel that you have to be, doing a certain amount of cases a day, and that's what the coaching program is about. That is not what this coaching program is about. This coaching program is about finding what your flow is and using your techniques that you've decided to adapt to your practice and bringing those into a very systematic an approach that makes you really love your practice and enjoy the abundance that can bring. This whole idea of having a coach is really just finding those blind spots in your practice and maybe in your life that maybe you weren't aware of, that somebody looking over your shoulder who's not emotionally involved with your practice and your life can sometimes have some really great input and some great suggestions. So the easiest way for us to connect is through my webpage, Endo2Endo.com. And there's a schedule a call. In my schedule I put up there, and you can just click on a time that works for you, and I get that message and we connect at that time. And I like to use that time to get to know who you are, what's going on in your practice, what's working, what's bothering you, what's your mindset, and all those kind of things to really find out what's going on.